I'm Dr. Scott Luper, Medical Director of the White Spruce Medical here in Fairbanks, Alaska. And I want to talk about how to survive getting COVID-19. And we talked about this before. Let me just kind of recap. Is the key thing is not to get acute respiratory distress syndrome. That's actually what's killing people. Most folks get the virus, they get an upper respiratory infection, they get a cough, they get a fever, they get fairly mild symptoms. But some people, because their immune system is hypersensitive, develop acute respiratory distress syndrome, where their lungs swell up, their oxygen levels go low, and they're basically they die of a lack of oxygen. So the key thing is doing what we can right now to make sure that if you do get the virus, that it doesn't progress to that. Now, first of all, I want to say there is no research on this. There is no proof that anything whatsoever is going to be helpful with this. But I don't think that we should just leave it at that. I don't think that the fact that the research hasn't been done should limit us, because it hasn't been around long enough for the research actually to be done. Though there is research that's being done, and some of it's actually come out recently. There is some evidence of things that can be useful. So here's a sensible, short list of things you can do that are easily available, reasonably easily available, that'll at best decrease the chances of you going into acute respiratory distress syndrome, and at worst will do nothing. They won't hurt you. They won't get in the way of anything that the doctors will be doing to save you if you do develop this. The first thing on the list is vitamin D. Now, vitamin D is a decent antiviral. Now, it's used for lots and lots of things in our body, but one of the things that it does is it actually helps our immune system. It helps our immune system regulate, and it actually acts as an anti-inflammatory. So anyways, let's just keep the list short. The vitamin D, fish oil is another one. There's actually evidence that the fish oil can help people survive acute respiratory distress syndrome. Most of this research is coming out of other causes of acute respiratory distress syndrome. Things like SARS, which is kissing cousins to COVID-19. Anyway, so fish oil. Another one is zinc. Zinc has been known for a long, long time to be a decent antiviral. In fact, today you can't find it because it's all sold out. I'm sorry to say, but if you got some at home in the cupboard, then you could start taking zinc. And the last one is mushrooms. Mushrooms regulate the immune system. They bring it down if it's overactive. We use it to treat autoimmune disease and immune dysfunction. Also, if your immune system's running low, it tends to bring it up. So let me talk a little bit about the research. Vitamin D, there's some research that came out day before yesterday, and it's showing that the lung injury in bird flu, avian influenza, has been greatly decreased. This is Chinese research. Now, the coronavirus is not bird flu. They're not the same thing, but acute respiratory distress syndrome is the same. It actually is, with the swelling in the lungs, with the inflammation. So this is helpful to know that there's actually quite a bit of evidence that this could be helpful. Tomorrow, we're going to have a roundtable between all the doctors here at White Spruce Medical, and we're going to discuss other herbs and other research and put our heads together, and we're going to do it live. So you guys can participate in the conversation. You can send us questions. You can at least view what we're doing here. You get to see this unfold. We're working on this every day. We're doing everything we can to make sure that you all survive. So tune in.